If you've ever heard the words prostate biopsy, your brain probably made a horror movie trailer in 3 seconds. Pain, infection, and that scary myth, what if the biopsy spreads cancer? And then you did what every stressed human does. You opened your phone at 2 a.m. and started researching, which is a polite way of saying you adopted 10 strangers' opinions from the internet, and now you're somehow more confused than before. So today, we're doing the opposite of panic. We're doing clarity. In the next 10 minutes, I'm going to break down the 3 biggest biopsy myths in plain English so you can walk into your appointment prepared, not terrified. Myth is shown. A biopsy is unbearably painful. Myth #2. Infection is basically guaranteed. Myth #3. A biopsy can spread cancer. And at the end, I'll give you a simple normal versus urgent checklist and 5 questions you can bring to your doctor, so you leave with a plan, not guesswork. Quick note before we start. This is education, not medical advice. I'm not your doctor, and this doesn't replace your clinician. Always discuss your personal situation with a qualified urologist. All right, let's kill these myths. A prostate biopsy is unbearably painful. Let's be real. Nobody hears biopsy and thinks, nice, sounds like a spa day. But here's the truth. The word biopsy sounds scarier than what most people actually experience, especially with modern numbing and good technique. Most biopsies are done with local numbing, and many centers use additional comfort steps depending on the route, the patient, and the clinic setup. That means the goal is not white-knuckle suffering. The goal is tolerable discomfort, controlled, and predictable. So what might you actually feel? Awkward pressure because of the location, no sugarcoating that. A quick pinch or snap sensation when samples are taken. Some soreness afterward. Sometimes temporary urinary symptoms like mild burning or frequency. A useful mindset is this. Most men don't say, I felt nothing. They usually say, it wasn't fun, but it wasn't the nightmare I imagined. And here's something people underestimate. Anxiety amplifies pain. If you walk in convinced it will be torture, your body tenses up, your breathing gets shallow, and everything feels worse. That's why I recommend asking a simple comfort question before you ever lie down on the table. What numbing do you use? Do you offer anything for anxiety? What will I feel step by step? What should I do after the procedure to stay comfortable? You're not being difficult, you're being smart. Because the real enemy is not just discomfort, it's uncertainty. So here's the punchline for myth #1. A biopsy is usually manageable. Not comfortable, not fun, but typically not unbearable, especially when expectations and comfort measures are clear. Infection is basically guaranteed. This is the myth that scares people the most. And honestly, I get it. Infection is a real risk. But guaranteed? No. And here's the part that actually matters. Infection risk depends a lot on the biopsy route and the prevention plan. There are 2 main routes you'll hear about. Transrectal biopsy. The needle passes through the rectal wall to reach the prostate. Transperineal biopsy. The needle goes through the skin between the scrotum and rectum to reach the prostate. Why does that matter? Because the rectum naturally contains bacteria. So with a transrectal approach, clinics take infection prevention seriously, often with antibiotics and specific prep steps. Meanwhile, transperineal approaches are often discussed because they avoid the rectal route, and research has suggested this route can lower infection risk in some settings. Now here's the healthy way to use this information. Not to panic, not to self-diagnose, but to ask better questions. If you're worried about infection, these are the 3 most practical questions. Which route are we using, transrectal or transperineal, and why? What is your infection prevention plan? What symptoms afterward are urgent, and what's normal? Let's talk about normal versus urgent, because this is where people get spooked. After a biopsy, some common side effects can include mild discomfort, temporary urinary changes, and yes, sometimes blood in urine, stool, or semen. And the semen part is the one that really freaks men out because nobody expects that. But here's a calm reality check. Seeing some blood afterward does not automatically mean something is wrong. What matters is your doctor's guidance, your symptom pattern, and whether anything becomes severe or comes with systemic symptoms. Now, urgent warning signs. This is the don't wait list. Your clinician may word it differently, but in general, things like fever, shaking chills, feeling very unwell, trouble urinating or inability to urinate, worsening severe pain. Those are typically call now symptoms. So the takeaway from myth #2 is simple. Infection is a risk, not a destiny. Route matters. Prevention matters, and knowing what's urgent matters. MYH-3. A biopsy can spread cancer. This is the myth that keeps people awake at night, and I want to handle it respectfully, because fear feels real even when the risk is very small. Here's the honest answer. In medicine, tumor seeding, where cancer cells track along a needle path, has been described in rare situations. But it's considered extremely rare, and it's not what typically happens with standard diagnostic biopsies. And this is important. Prostate cancer doesn't become advanced because someone disturbed it with a biopsy. Cancer progression is about tumor biology, aggressiveness, time, and treatment strategy, not a needle magically releasing cancer. So if your brain is still saying, okay, but what if I'm the rare case? That's normal. You're human. Here's the calm way to respond. Ask your doctor, how often do you perform this biopsy? Which approach do you use and why? How do you reduce risks like infection and complications? The goal isn't to argue. The goal is to feel confident that your plan is based on experience and good practice. Because the real danger for many people is not the biopsy spreads cancer. The real danger is avoiding needed evaluation out of fear, especially if risk is higher. And that brings us to the practical heart of this whole video. A biopsy is not a punishment. It's information. It helps you and your doctor answer one question: what is actually going on and what's the smartest next step? The normal versus urgent section, quick and very practical. Let's summarize this in a way you can remember without taking notes. Often normal, depending on your doctor's guidance. Mild soreness, mild urinary changes, small amounts of blood in urine or stool, blood and semen that can look dramatic but is often temporary. Often urgent, call your clinic or seek care. Fever, shaking chills, feeling seriously ill, inability to urinate, severe worsening symptoms. Always follow the exact instructions your clinic gives you because every patient and every protocol can differ. But the point is, you should not leave your procedure guessing what's normal and what's urgent. The 5 questions that turn fear into a plan. Repeatable checklist. If you want one simple script for your appointment, here it is. Which route are we using, transrectal or transperineal, and why? Will you sample systematically, target an MRI lesion, or both? What is your infection prevention plan? What symptoms afterward are normal, and what symptoms are urgent? If you ask those 5 questions, you're not walking in blind. You're walking in informed. All right, rapid fire recap. Pain myth. A biopsy is usually discomfort and pressure, not torture, especially with proper numbing and clear expectations. Infection myth. Infection is a real risk, but it's not guaranteed. Root and prevention steps matter, and you should know the urgent warning signs. Spreading cancer myth. The idea that a biopsy spreads cancer is a fear-based myth. Tumor seeding is considered extremely rare, and biopsy is a standard way to get the information needed for a smart plan. So here's your calm, grown adult strategy. Walk into your appointment with 2 big questions. Which route and how are we targeting? Then ask, what's your prevention plan? And what symptoms are urgent? And hey, if you're about to Google this at 2 a.m., I support curiosity, but I also support sleep. Close the tabs. Write down the 5 questions. Bring them to your appointment like you're the CEO of your own health. Clipboard optional, but highly recommended. Important disclaimer, this video is for education only and not medical advice. I'm not your doctor, and this does not replace care from your clinician. Always discuss your specific situation with a qualified urologist. If this video helped you feel calmer and more prepared, subscribe to Nourish Today for facts over fear every week. And watch the next video in this series because we're going to keep making this process simpler, clearer, and a lot less scary.
Thanks for watching. Stay informed, stay calm. Subscribe for calm, evidence-based health here on Nourish Today.